Ontario's Chief Medical Officer of Health is facing some criticism tonight for failing to follow his own advice. Just days after strongly recommending wearing masks in indoor settings, Dr. Kieran Moore attended a big party and was seen without one. With more on this, we're joined by CTV's Siobhan Morris. Siobhan.
Well, Scott, we saw that really kind of surprising scene, I think, of Dr. Moore at this party last night after making that strong recommendation that was really intended to protect the most vulnerable Ontarians, especially kids under 5. Those are the people that we know are showing up in hospitals in large numbers with things like RSV and the flu, and to some degree COVID-19. So a strong recommendation from Dr. Kieran Moore on Monday. Last night he was out without a mask. We heard from the Ministry of Health today that Dr. Kieran Moore does a risk assessment for everything he does, including private events like this one. They talk about other steps he takes, that he screens daily for any symptoms of illness, that he practices good hand hygiene, is up to date with his vaccines. We're also hearing slightly different messaging today from the ministry, saying that Dr. Moore encourages all Ontarians to decide when it makes sense for them to mask. We also heard from the Premier today sharing a similar message.
Well, here in Ontario, masking is personal choice. If you're around vulnerable people, you're around young people, that's going to be your choice. So, that's what's going to happen. It's the people of Ontario. They've been through 2.5 years of this. They know if they need a mask. They know if they don't need a mask. That's going to be up to them.
We did talk to some parents today outside Sick Kids Hospital here in the city, and there was some frustration about what they feel is mixed messaging, do as I say, not as I do, and they'd like to see some more consistency coming out of Queen's Park when it comes to masking. Scott, I'll send it back to you.
CTV's Siobhan Morris, thanks so much for the update, Siobhan.